Hi everybody, welcome back to AP Psychology. With me, Miss Baines, your teacher, where you are able to pause and rewind me as I deliver you your latest content. So go ahead and grab those colored markers, a nice comfy space in which to work, and of course don't forget those ever important binder notes that go in lockstep order with this video called Unit 8, Video 1, on clinical psychology, which is the introduction to different disorders. This will take place on pages 1 and 2 of your new binder notes. Okay, I'll see you on the other side. Hello and welcome to the first set of notes for what is Unit 8, Clinical Psychology. I'm so excited. We're finally talking about actual psychology. As you can see by today's learning targets, clinical psychology speaks to the psychological disorders or abnormal behaviors and the treatments of those abnormal behaviors. In other words, psychological and personality disorders and mental illness. Right? So in this first set of notes, we're kind of introduce the different mental disorders and take a look at mental illness and what that looks like as determined by what is called the Bible of Psychology, the DSM-V, our psychological diagnostic guidelines. So right here we have an excerpt from our text from somebody named Mark who is diagnosed with OCD, or obsessive compulsive disorder. I felt the need to clean my room. I spent 4 or 5 hours at it, and I would take every book out in the bookcase and dust it and put it right back. At the time, I loved doing it, but then I didn't want to do it anymore. But I couldn't stop. The clothes in my closet hung exactly 2 fingers apart. I make a ritual of touching the wall in my bedroom before I went out because something bad would happen if I didn't the right way. I had a constant anxiety about it. As a kid, I also suffered. It made me think for the first time that I might actually be nuts. All right, so let's talk about this. Kind of look at that abnormal connection, you could say, between his ritual of touching the wall and having to do it before he leaves the room, right? It doesn't solve any particular problem for him. Right? Approximately 1 in 5 adults in the United States, or 43.8 million, or 18.5%, experience some kind of mental illness in a given year. This is all from NAMI.org, okay? I highly recommend that you take a look at NAMI.org and go check out their website on mental illness and the disorders, okay? Approximately 1 in 25 adults in the United States, which is 9.8 million, or 4%, have experienced a serious mental illness in a given year. It interferes with your limits or one or more major life activities. So this isn't just a unit for us to learn about because we want to do well on the AP exam, right? These are about people that we know and love, perhaps even ourselves. Okay, it's important in our life right now to understand this because other people are important to us. Another important thing to note is that many disorders like depression and schizophrenia exist in all cultures across the world, right? So these are disorders that aren't just here in the Western society, right? They're all over the globe. Because it's so prevalent and because it's so applicable, right? Our need to know information in our culture today, and not just our culture, but worldwide. So what is abnormal behavior? What defines abnormal? Why is it important for us to define abnormal behavior? Well, in a way, haven't we all behaved, quote, abnormally at some point in our life? You might be asking, well, yeah, but I'm not mentally ill. What made it disordered is the key question that you want to ask yourself. Another important question we want to ask is, how is behavior abnormal enough to present a danger to either somebody else or to ourselves? Or when is it serious enough to require detainment or locking somebody up, right? When do our civil liberties go to the wayside in order to save themselves or somebody else? Right? These are really important questions to consider as you think about the different mental disorders that we're learning. It's important for you to kind of see that in the DSM-5, following criteria for labeling behavior as disordered. 4Ds are super important, right? So it's a behavior. A disorder is a behavior or a psychological syndrome or a pattern that occurs in an individual, and it reflects some kind of underlying psychobiological dysfunction. So the consequences of which are clinically significant distress. So painful symptoms or disabilities, and an instance of this is an impairment in one or more important areas of functioning. All right, a couple of things here. First of all, there's dysfunction and then there's distress. Now, these must not be merely an expected response to common stressors or losses, right? Like the loss of, say, a loved one, right? Or a culturally sanctioned response to a particular stressor or event, like a trance state, perhaps for religious rituals or people fasting. They're not depriving themselves or punishing themselves if it's a religious ritual to fast, right? I want to bring to your attention that it's primarily a result of social deviance or the conflicts with society. It's kind of strange to think of that word deviant, right? Deviant behavior. It's not about somebody who's trying to do the wrong thing necessarily. So we need a little more clarification here. Okay, so we really also, you want to be able to define the word disordered behavior, okay? So first up is deviant. Deviant is actually an important one. It means that we go against the norm of a behavior. Now, what may be abnormal in one culture could be normal in another culture. So it has to be culturally determined, okay? The second D is distressful. Another important meaning because it causes the person or others distress. It disturbs them in some way, right? And then they have some, not necessarily anxiety, well, a little anxiety, but there's some turmoil, right? There's some problematic conflict, you could say, over the behavior because it's dysfunctional. It causes dysfunction in the person's life, right? Their daily life. And then it alters the functioning of their daily life. Okay, dangerous is a possibility, as well as there's a possibility of causing harm to either themselves or causing harm to somebody else, right? And finally, unjustifiable, and that there's no real reason why this behavior should be occurring. And that's like what is said from the APA. That's what's said from the APA. And then it's not just expected responses, right? No matter how erratic somebody might be behaving, for example. A major stressor in somebody's life, for example, is the loss of a loved one, right? Something like that. And with hyperactivity disorder, there's a lot of research around this particular, not in mental illness, but it's a definite developmental occurrence in a kid's life. Right? It's something that's happening in a trend that's an uptick in our culture. And children, mostly boys, are being diagnosed or perhaps overdiagnosed with ADHD, attention hyperactivity disorder. So when a child and their parents, right, brings their child to a doctor to kind of figure out what's going on, why is my kid acting out like this, they think that this might be a diagnosis. The doctor, though, needs to go through and see, since you have a boy, a son, they're already at a higher level of hyperactivity just from being that gender. It's just kind of a thing, right? Boys will be boys. At what point, though, does it become abnormal or deviant from what is normal for their average age? Let's say a 7-year-old. A big one is being that it's causing dysfunction in the child's life, right? It's disruptive in some major way. It's impacting their education, their home life, their friendships, their social circles, right? Let's say it's impacting their relationships at home with the parents and siblings. And let's say it could be potentially dangerous, right? They could hurt themselves or one of the younger siblings. And of course, it's stressful. Does this child have some distress because of the hyperactivity or in their attention deficits, right? Those questions have to be asked in a particular order in order to say whether or not ADHD is occurring. It's important for you to understand the history of psychological disorders, okay? And that if you think there's a stigma today about having a label attached to somebody, you can't even imagine how bad it was 100 years ago. Okay, looking around we've come a really long way in mental illness and mental wellness. Okay, you have to kind of consider the history here. Ancient treatments of psychological disorders include what we call trephination. Okay, trephination is pictured here on the slide. It was this idea that they would drill or bore holes into the human skull in order to remove the evil forces that the patients under psychological distress was displaying. Okay, so psychological disorders, things like exorcisms, being caged like an animal, beaten, burned, castrated, mutilated, transfused with blood because they were seen almost as demonic or possessed like the devil, because there wasn't any scientific research, right? There wasn't any real science around understanding what was happening to the particular individual, right? How can a mind be ill, right? So for the first time with Philippe Pinel, we see from France what is now call the medical perspective, right? We get away from the dynamic, almost religious or spiritual aspect of evil forces being exorcised out of the human skull, right? Into looking at it through a medical vantage point. Okay, Pinel insisted that madness, psychological disorders, was not due to demonic possession. You were not being possessed by some devil, but an ailment of the mind, an illness of or sickness of the mind. Okay, with a lot of other contributors, we have what is called now the medical model, the medical health movement, where mental illness needs to be diagnosed on the basis of symptoms and a checklist that are cured through therapy, right, and medications. Right? It may include treatment even in a psychiatric hospital. It's not something that you have to get out of the person. It's something that you have to treat inside the person, right? Just like any other physical ailment. And that is what the medical community wants us to understand, right? That's the medical model of 2023. It's this new BioPsychoSocial approach, that three-pronged approach that all interconnect with each other, right? This and many other topics assume that there are three parts. There's a biological, a social, and a cultural, right? Psychological factors combine to interact with each other to produce the psychological disorder. So you want to maybe zoom in on one of these here to see what's going on. The biological influences, for example, and it's a combination of the roles, okay? The roles and expectations in your culture, in your situation, in your individual experiences that matter as well as the stress and the trauma that you may have been dealing with. Whether it's in the past psychologically impacting you from a traumatic event when you were little, or it's still impacting you as you are growing up or as an adult, right? Your genetic predisposition and the biological influences are, again, also really important. They interact and influence each other in the triad. Okay, it's important to kind of rewind your brain a little back into the beginning of the school year and get back to Unit 1 when we talked about the different historical perspectives. We talked about this three-pronged perspective, right? What did they have to say about abnormal behavior, right? The psychoanalytical behavior, talked about a lot in the personality unit, believes that the psychological disorders stem from some unresolved childhood conflict, right? Something that we press deep down in our unconscious, right? They believe that it's about the personality too. So to understand the roots of the disorder, you must look at the person's unconscious mind and tap into the early life history in order to see what's going on in their adult. Childhood was kind of repressed into their unconscious mind. Okay, behavioral, remember, think of those buzzwords. How does somebody behave? What can you measure? Believe that behaviors are learned responses and that you can retrain somebody to behave in particular ways. The later part of this unit is in treatment. We talk about the behavioral aspects and how the behaviorists treat things, especially anxiety disorders, right? With phobias such as like obsessive compulsive disorder, or OCD, like we started in the beginning with Matt. Okay, so to understand the disorder, you have to analyze how the behavior has been learned and what reinforces the continuation of that behavior. So think of this in terms of a phobia with something like fear, right? What is making somebody have that fear over and over again to say that spider or to that movie or to that person that they're afraid of? And cognitive, right? Let's think about thinking. Right? The cognitive psychologist believes that our thoughts and beliefs are at the root of psychological problems, right? That we can unteach and train our thoughts, right? Illogical or correct thinking can be trained. The only way to, quote, fix behavior is to change the thoughts and the belief system. I think you'll come to see this as being more and more applicable the more and more we talk about these different subjects, and that thinking really does impact how you behave. Right, how you approach a situation and how you handle life, right? Just changing that mindset, right? Changing that thinking changes a lot of your behaviors. Humanistic, right? These are the kinds of hippy-dippy ones, right? Free to be you and me, right? Just be good, put good out, you'll bring good in, right? The potential is so that people are responsible for their own behavior and even abnormal behavior. So the focus here is on the relationship between the individual and society, right? How people view themselves in relation to others, okay? They believe that disordered individuals don't have enough self-worth. They have things like conditions of worth placed on themselves, right? And that makes them feel and act out in a certain way, impacting them in such a severe manner to cause abnormal behavior, okay? Socio-cultural believes that abnormal behavior is shaped by family, right? Our environment, not just genetically, right? But by a situation that society sees fit, or that our culture sees fit, or that our family choices are what shape us most. So relationships with others can support and even cause abnormal behaviors. And stress is one of these encounters in life that influence the disorders, right? That either they have it or they don't have it. It's all about each individual situation. The cultural pressures and the norms of society or a culture impact normal behavior as well. Probably, if I had to say the most important thing or understanding that you need to come to and take away from this set of notes, okay? Classifying psychological disorders completely comes from the Diagnostic and Statistical Manual of Mental Disorders, the DSM-5. The most recent edition is 5, the 5th one. That's why it's called DSM-5, right? It's the 5th one. It was released in 2012, right? It describes 400 psychological disorders compared to 60 that were in there in the 1950s. Think about that. In the last 75 years, how much has opened up in the world of mental illness. Okay, something to consider there. American Psychiatric Association rendered this manual kind of as the Bible for all clinicians, right? They have it. I have a picture of it here for you. Make sure you have it jotted down. The Diagnostic and Statistical Manual of Mental Disorders in order to describe psychological disorders. Okay, we'll talk about why it's so important, right? So, the different sections of the DSM include kind of an introduction to the book and how it is used. Super important for psychiatrists, psychologists, and social workers to be able to diagnose, right? What is the criteria? What is the checklist? What are the codes, right? This is where you have a list of all the disorders and all the symptoms and what makes someone classify under a particular disorder. An emerging measurement comes out, right? We have models of meaning, how to go about diagnosing a certain disorder with certain measurements, right? Different assessments. What are the goals of the DSM? Being to describe 400 disorders, helping doctors to diagnose them correctly, and to indicate how prevalent the disorder is, as well as the disorders being outlined in the DSM-5, right? The symptoms, what it looks like, what the people present with, right? These are reliable diagnostic tool by different professionals are similar. That's so that all different professionals, whatever way that you approach psychology, are going to come back with the same diagnosis. Okay, when doctors are on the same page, some might criticize the DSM-4 by any kind of behavior with the compass of psychiatry, right? Just something to think about. We're looking at a behavior here. So how does that indicate the measurement or the measures of the mind? Okay, it's important to consider labeling and what labeling might do to a person. We're talking about already somebody who's fragile of the mind, right? So you don't label a person incorrectly, right? Behind that psychological disorder is a human being. We have to talk more about this in class, but I want to bring it up here as something important. The critics of the DSM argue that labels can actually stigmatize individuals by assigning them arbitrary conditions and value judgments. And that's just because this person is experiencing these particular symptoms that I see here as categorized in this disorder. Right? There are multiple disorders that overlap each other, and it must mean that they all have other things too, and they act like other people who have this diagnosis. To be labeled this way is a major piece of research that you should know about, hence why I put a star over it. Rosenhan's experiment, published in an article called Being Sane in Insane Places. Rosenhan and some of his psychologist friends, I believe Martin Seligman was one of them, some well-known psychologists, they famed or defamed or faked certain psychological disorders by going to a psychiatric hospital, right? Into a mental ward or into the institution and getting themselves admitted. Essentially, getting themselves diagnosed by pretending to have certain symptoms. Right? They wanted to see how they would be treated, right? They all talked about hearing the word thud in their head, okay? It wasn't actually happening. It's just that they heard the word thud. So they said this word thud in various hospitals, and that's why it's known as the thud experiment. Every single one of them was admitted, with some of them not being allowed to leave for months, okay? They were given the medication that was prescribed for certain disorders, and if they were diagnosed with schizophrenia, for example, right, they were on all these really strong psychotropic medications, showing you that there is unreliability, right? There are issues in the psychiatric treatment world. People lie. What's important for us to understand about Rosenhan's, though, the research is another interesting part about labeling people with psychological disorders. Right? They got a real insight into how that people were being treated, okay? Another aspect is the insanity plea, right? In Law and Order, okay? When people, there are moral and ethical questions being raised about how society should treat people who have mental disorders and have committed crimes when they have that disorder. Okay, should somebody who is labeled as insane or mentally ill be able to not be convicted for the crimes that they commit while they have that disorder, right? This guy here is called the Unabomber. I mean, you could do some research on him too. He bombed various locations and universities, such as in airports, right? The media news outlets called him the Unabomber, right? Because of the university bombings, uni being the key word here, right? He also loved, uni means one, and he's kind of a recluse and lived and functioned all alone. He hurt a lot of people and killed a few as well, right? All of his lawyers and multiple psychiatrists said that he was mentally ill, but he was denied the insanity plea, even though he was totally mentally ill. He would have gotten treatment instead of getting put into a prison. He would have gone to a place for the criminally insane. But instead, he didn't get that help. He just, taking an insanity plea, right? The person is treated differently than somebody who has been convicted for the same crime just because of the way that they're labeled. There's a lot of controversy around that. Labels, however, can be helpful for the healthcare professional, right? They're helpful because it gives us a shared vocabulary. And as professionals, we are communicating, and on a medical team of somebody, we all want to help somebody and help one another in establishing the correct therapy. Okay, the correct diagnosis gives you the right therapy, and talk about best practices, what's going to help this particular person the most. Right, having that label allows them to know what's wrong, which allows them to know how to treat it, right? So understanding the categories, there are lots of them, and ever since the DSM-5 was released, we've had some changes, okay? So according to College Board, And the next one that we're going to talk about in our next video is anxiety. I talked about it a little bit with the OCD, the obsessive compulsive disorder, and the related disorders, as well as trauma and stress, right? All of these things are related to anxiety, right? So they're all going to be encompassed under anxiety diagnosis. And that's just not the case anymore. They are separate categories. And then finally, I leave you with this. I want you to pause and kind of look over all of this again and I want you to take a couple of minutes and go to NAMI.org and really check out the website. Take a look at the prevalence of mental illness. And this is kind of how I started the slides as well. So you can go ahead and do that. You'll see that 0.1% of adults in the United States live with schizophrenia. 2.6% of adults in the US live with bipolar disorder. And we're not just talking about, something to do well on the test here. We're talking about people's lives. It's important to understand what's going on mentally in their minds. So just as if you were suffering, right? Just as if you were talking about what's going on in the life of, say, a cancer patient, right? The mind can be ill too, right? Just like the body can be ill, the mind can be ill. And we need to treat those people with compassion and sympathy and empathy as human beings. We need to help them seek the treatment that they need and deserve. Okay, stay tuned for our next set of notes on anxiety and obsessive compulsive disorders. Have a great night. I'll see you tomorrow. Bye now.